Good afternoon. It is your coaching colleague, Dr. Brenda Bowers, with Because We Are in the World, predominantly put together for the congregants at Vessels of Honor Church in Mequon, Wisconsin, but understanding that our reach is broader. So we hope that anyone who tunes in for these segments receives some information that can help them function as highly as possible with the most information available to make informed decisions because we are in the world amidst a pandemic. So, as we look at the COVID-19 update for April 17th, 2020, we look at the Wisconsin data, we look at the Milwaukee County data, we look at the city of Milwaukee data, and then we look at the global data as well as the national data. The databases that we rely on are the state and county and municipal reportings that occur at those levels, and then Johns Hopkins University and medicine, who are providing just an excellent global dashboard with now another segment within that dashboard that gives us information regarding the United States of America. Also, we use our colleagues and partners at Fox 6 Now because that's who provides me the best navigatable layout for those data points that we are trying to share with you in a short period of time every day. So the first thing is, what is because we are in the world? We are in the world, but we're not of the world. And we know that our Lord and Savior Jesus Christ told us to be of good cheer. In this world, you're going to suffer tribulation, but I have overcome the world. And he prayed to the Father, Lord, these are not of this world, even as I am not of this world. But instead of taking them out of the world, would you please just keep them from the evil? So, because we're in the world, there are things we have to do to navigate and to be good citizens because it's our responsibility to role model health. And the only way we can role model health is if we know what it means to be healthy. How do we stay healthy? So, we talk about that a little bit in this segment. But then I also provide, because we're not of this world, a separate segment on scriptural teaching. So, for the data for Friday, April 17th, 2020, let us look and see what's happening with COVID-19. First of all, state of Wisconsin via the Fox 6 Now. So, Fox 6 Now is showing us that from yesterday to today, we have 4,114 positive cases with 208 deaths. So you can see some of the writing above here where we're looking at the reaching the death toll. I think it is important when we look at of the 4,045 people who tested positive, 1,153 have required hospitalization, looking at 29%, and that was DHS at 2 p.m. today. So then we see this update. So the data just, looks goofy when you say, well, this number is different than that number. Just know that the numbers catch up. It's just really how they are recorded. So then what you're looking at when you see the 1, the 6, the 27, the 357, the 2,055 numbers that you can see. Let me just put my little pointer over here. Like these numbers where they're really high. Well, now most of you can probably say where those are. We're looking at Milwaukee County. We're looking at Dane County. So this is showing us in this orange color, those are the number of cases. And then when there's also a screen on this particular data look that then shows the red, which is the death toll that COVID-19 has had in Wisconsin. But we look at that a little differently. One of the first places that I like to show you is the actual DHS Wisconsin.gov site And in that right-hand area, Wisconsin COVID-19 summary, and you see as of today, April 17th, 2020, they update this around 2:30 p.m. every day. So what we see is what the reports have shown, because this state data, remember, is just a compilation of all of the databases that feed into it to get this number. So what all of those counties and cities have reported up to a state level is that a total of 42,365 negative test results have occurred in the state of Wisconsin, with 4,045 positive confirmed cases, with 1,153 of the 4,045 hospitalized, 29%. And then of the 4,045 number, 205 deaths. So we know that one death is one death too many. We know that COVID kills, and we want that number to stop growing. But that is the state of Wisconsin data. And you see there are other things. If you want to go to this site, dhs.wisconsin.gov/outbreaks/index.htm. You can see You Are Safer at Home. You can see the updates and the briefings. So any information that you want from a state level, then you are able to navigate there from this page. But a very nice summary page. Resilient Wisconsin is still there, which is very important as well. And then when we look at this Milwaukee County, I did refresh this right before I started, but I refresh again here and the numbers stayed the same for us. Now, Milwaukee County, look, confirmed cases, 2,055. So we're continuing to have more confirmed cases. We know we're going to have more confirmed cases the more that we are able to test. And then those confirmed cases, the racial spread is still very similar, highest in African American, then we followed by white, followed by not reported, followed by Hispanic, followed by Asian, followed by two or more races, Native American. We have much lower numbers. So let's just stay on this left-hand side as we did yesterday, because I heard that at least gave you some information to look at. Confirmed cases, racial stratification, age. Look at that. That age, it doesn't matter. We have had confirmed cases at every age. Do not purport that young people are not impacted. Everyone is. That's the age stratification from 0 to 80 plus. Gender, more females positive than males, and you all are probably saying it with me, but more males die than females. And we also have one transgender reporting as well. And then we have, of that 2,055 number, we have the city of Milwaukee leading with 1,500 of that 2055. And here on this left-hand side, we're continuing to see the positive cases grow. We anticipate that because we're testing more individuals. So now when we go and we look at this right-hand side, where we have 111 deaths in Milwaukee County, and we look at the deaths by ethnicity, of 111 deaths, we have 63 of those are African American, 41 white, 5 Hispanic, 1 non-Hispanic, 2 more or more races. So from an ethnicity standpoint, similar to the confirmed cases, we see a disproportionate number of African Americans who are dying from COVID. Of the 111 in the entire county of Milwaukee, we are seeing 63 of those individuals are African American, and 41 of them are white. So one death is too many, but it is important for us to understand the stratification of the impact of COVID-19. So now when we look at deaths, and I will just click back over here and show the age stratification. So I want you to look, if you can, this bar chart opposed to this bar chart. So when we look at confirmed cases, look at how rounded this is. Look at how much more normalized it is. It impacts all ages, right? Confirmed cases, positive cases. But when we get over here and we start looking at the death impact, then we don't have that nice curve. The death impact, we start seeing at 50 years old, you start seeing a major change in the number of deaths at that age range. So 70 to 79 remains that highest death range. So we're really looking at the impact of COVID, and something that Milwaukee County is going to start to do, and I just saw it pop up on my screen, is we're going to start tracking in our correctional facilities. So I will look to see how that's going to be done and work to incorporate that in the future. So here we have that death toll by gender, and we just, in all fairness, look at cases by gender. So remember, they're going to be opposite. So you have confirmed cases by gender, more females have it than males on the left. And then you have confirmed deaths, more males die than females. So of that 111, 62 are males and 49 are females. And the reported deaths we see down in the right-hand corner, where we're still going up, and we just do not like that. And we know that it's going to turn around because we're all going to continue to do our part in stopping COVID from being the killer. And we're the ones that are going to annihilate COVID. And we're going to do that through our cleanliness. You know, don't be mean, stay clean. We got to stay clean and lean. Some of the way that we're going to get clean is by just getting rid of junk and just making a decision to live better. Making a decision that what we eat matters. How we move around matters. It's very important because even when we're doing safer at home, we want to make sure that we are exercising. This gives us a great time to eat better. I am trying to only have to cook every other day, and I'm trying to make something that my husband and I can eat, like homemade chicken soup with, you know, actually cutting up the vegetables and putting them in there and creating the broth, or making a stew where you are able to have something. And even though it's in April, chili, or one of the things that I made this week was macaroni chicken salad, homemade. So you're able to do something cooler as well as something hot, and just really eating in a way where accompanying with all of those fresh fruits, fresh vegetables, managing the carbs, and then committing to at least 30 minutes of exercise every day as we deal with our comorbidities. We are not exempt in our household of comorbidities, but we have to make a decision. And young people, don't just stick around in this world living sloppy and end up losing your life at a young age. No, we need you to be healthy. Parents, while your children are in the house, make sure that you are having them exercise. Jumping jacks still work. Sit-ups still work. Pedaling with your feet still works. There are so many things we can do to make a decision that we are going to conquer COVID simply by doing the things that we should already be doing as good citizens, because we're in the world. So you see this 2.2 number of confirmed. United States obviously outpacing everyone else. And yep, it's going to depend on who you ask, because here what we're looking at is confirmed cases. So United States is testing more. validity of tests is a huge thing, and we are, continuing to look at how the validity of the testing, meaning, are there a lot of false negatives? Are there a lot of false positives? Are the tests being handled the same everywhere? Is it the same company? Which company is testing? Who gets to be tested? All of those are real questions that we're grappling with. That's why what I'm providing you is just a very high level overview, so you can just look at the data and just know that those discussions are absolutely happening 24 hours a day. So when we look on this right side, total deaths we see is at 148,654 globally, and now it is on that section that we can look at recovered. 565,876 have recovered. So when we look at the death toll opposed to the recovered toll, many more people, by the hundreds of thousands, are being recovered. However, we know that does not minimize any of the deaths, and 148 is still a huge number. That's against the confirmed number, 2.2. Global. This is still global. Now over here, we see total tests in the United States. So now we're looking at the number of tests. How many people have been tested? Whether they tested negative or positive, how many have been tested? So on this dashboard, you can actually scroll and you can see how many people have been tested. In Wisconsin, 44,849 people have been tested. And the other thing that I really like about this dashboard is that it does take you from the highest to the lowest. So 550,579 tests have occurred in New York. That's important. And then there are some areas that are not impacted as much. And we look at Alaska, and there we've had 8,735 individuals tested. So the other new area is our United States map on our John Hopkins scene. So when we look at this, and just God bless and pray for the people who are, there are so many really good scientists and researchers out here. We don't want to get so clouded on the things that are going wrong that we're missing the fact that there are some incredible researchers, incredible analysts, just some really incredible scientists, individuals who are doing this. This doesn't just pop up because you call it into action. This isn't a prayer where we're saying, come forth, come forth. No, it's people working to get us this data, which is very important. So when we look at the total confirmed, here you can now watch these numbers by county. So you can look Cook County, for instance. We can see 18,087 confirmed cases, all rolling up to this 662,045 number. And then when we come over here on the U.S. tab, in the United States, there have been recorded 28,998 deaths. That's U.S. And then total recovered, 54,703 recovered United States. So you're able, you can look at a county here, you can look at a state here, and it will show you that. It's just, so let's just check it out since we are looking at Wisconsin. Let me see if I can get us down here. So, all right, so we have Wisconsin, and then here it's letting us pick a county, and let's pick Milwaukee County. And now look at that. Voila. So now we're looking at the state of Wisconsin, and we asked for data on the county of Milwaukee, and the data that this roll-up database has is that there have been 114 deaths, but Milwaukee County is not reporting recovered. So we have to see how that data is a missing link there. We definitely want to be able to track that appropriately. Down here, they're looking at confirmed, and that's by date and then also death. So when it first started, you see nothing, 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 and then you see right at that March 20th number, we start getting the death toll, and it goes up very high, very fast. And then top 20 counties. So we see those top 20 counties of death in the United States. So a dashboard that can be used many ways. And then this last area, someone did ask me about this, and I want to make sure before I close that we look at critical trends. So when we look at critical trends, what does that mean? Which states have release breakdowns by race? Okay, this is new. So look at this. I'll read this to you. So it's called Racial Data Transparency. So this map shows the United States that in the US, the states that have released COVID-19 data by race, because all have not. And it's broken into 3 critical categories: the confirmed cases, the deaths, and the number tested. It is essential that policymakers and other decision makers have access to these data to inform their response to the pandemic. It is also important that these data are released publicly to shed light on the intersecting forces of racial disparity, underlying conditions, and poverty that affect how the virus spreads throughout the United States, because there is a direct correlation with economics and race and health disparities that show us the impact of poverty and disenfranchised areas, and how that it changes the numbers dramatically. I'm stopping myself because I could go off on a tangent in that area, because I get excited about looking at the impact of economics on race and disparity, because it's a solvable issue. But confirmed, there are 34 cases that report by race, 34 states, that report also by race, and Wisconsin does. So that's good. And I know some of you are Illinois watchers. Illinois does as well. And death, there are 26 states that report death, and those are the states that are reporting the number of deaths by race. And we see Wisconsin is there as well as Illinois. And then testing by states, only Kansas and Illinois. So Illinois, hats off to you, and Kansas. But what we don't then have, Wisconsin, is the number of people by race who were tested. But we do have the number of individuals by race who have been confirmed positive, and the number that have died. So a lot more. It's been about a 25-minute segment today, but I'm really working hard to provide you with the information that you requested. I do listen to your requests, and I do respond accordingly. But because we are in the world, we need to really consider the impact of COVID-19 in our own bodies. No one is exempt. Protect your babies, protect your grannies. You got to do it from one spectrum all the way to the other. And most of all, self-awareness, self-responsibility. Get a relationship with yourself. Become aware of yourself. What are the things that really do put you at risk? You as an individual, how are you eating? How many times do you touch your face? How many times do you wash your hands? Have you been staying at least 6 feet away from other people? Are you doing unnecessary travel? Are you doing non-essential things, even within your home? Are you able to find things that will distract you from the obsession of it? I could be on here all day doing this, so 25 minutes is pretty good a day. Some people are looking at this 24/7. Unplug, take a break, meditate. Just make sure that you are really taking care of yourself in the midst of this COVID-19 crisis, and pray. Pray because we are in the world. Prayer still works. Pray and call up somebody and pray with them. Tell someone that you love them. Make sure that we are encouraging and affirming each other. It is tough. It is tough out here. And many of you are receiving your stimulus dollars and you're saying, wow, I got money and I can't even go to the store. This is when I was going to buy a TV. This is when I was going to buy new furniture. Well, this might just be a time to say, thank you, Jesus. Maybe I just saved my money, or I'm doing the things that God has directed me to do. The Lord still speaks. He's still speaking. I have been watching how churches are raising funds during this time and burning mortgages and vessels of honor. Hop on it. That works for us because we have one that needs to be burned as well. Be positive. Be patient. Be productive. Because we are in this world, stay safe. Stay saved. Sanctification just means clean. So stay sanctified. Spend 20 minutes washing those hands. Keep your hands away from your face. If you're a hugger, you don't just get to say, well, I'm a hugger. I don't care nothing about COVID. I'm a hugger. No. We care about COVID and we are huggers, but we're not huggers right now. We air hug, we blow kisses, and be careful with that. Singing is now being said to carry the airbornes. They're living out there a little longer. All kinds of things being reported today. The alcohol is a negative, not a positive. So drinking is now showing that it's exacerbating COVID-19 in confirmed cases. So just be mindful. Be mindful. Be helpful. Be happy. Because Jesus said, be of good cheer. I have overcome the world. Pray much for me because I need it. I need you. I hope that you need me and that I am meeting the needs that you have. Until soon, love and peace.